I'm Dr. Linda Gromko, and this is Transgender Medicine Made Simple. Today we're looking at a question of the week, and that question is, what's the difference between finasteride and minoxidil for treating hair loss? Hair loss is a big problem for transmasculine folks on testosterone, as well as for transfeminine individuals who have already experienced testosterone-related hair loss. Point number one, the main difference between finasteride and minoxidil lies in how they work. Finasteride, also called Propecia or Proscar, work in a hormone-mediated way. Minoxidil, also known as Rogaine, has a mode of action that doesn't involve hormones at all. But first, to understand any of this, we need to know about testosterone and DHT, or dihydrotestosterone, and the effect of DHT on hair follicles as they grow. This is very important. Here are the basics. Testosterone, or the male hormone, is converted to another hormone, DHT. DHT then works on genetically susceptible hair follicles, making them smaller. This is called miniaturizing them. With fewer hair follicles active, there are fewer hairs that develop. Point number two, mechanisms. Finasteride works by preventing the conversion of testosterone to DHT. Finasteride blocks the enzyme 5-alpha reductase, which is required to convert testosterone into DHT. With less DHT available, there is less shrinking or miniaturization of the susceptible hair follicles, so the hair grows better. Additionally, finasteride does not stop all testosterone from converting to DHT, but it lowers DHT significantly, like about 60 to 70%. Because it works on all testosterone in the body, finasteride may have systemic effects like decreased libido, mood changes, and I've seen some trans male patients who reported spotting or periods while taking it. Minoxidil, on the other hand, does not impact hormones at all. In fact, it was actually developed as a blood pressure medication initially. Minoxidil lowers blood pressure by dilating or opening blood vessels, but this also increases blood flow to hair follicles. So it lengthens the growth phase or anagen of the hair follicle. It helps the follicles that survive in spite of the naturally occurring DHT grow better. But two cautions about minoxidil: don't use it if it drops your blood pressure. You might know this by dizziness or lightheadedness. And do know that minoxidil can be toxic to cats, so pay attention to that. Point number three, both finasteride and minoxidil come in two different forms, and they can be used together. Finasteride is available as a prescription tablet, which is FDA approved for hair loss, and by lotions or gels or sprays, which are not FDA approved. Minoxidil is available as tablets or as a topical lotion. Tablets are FDA approved for hypertension, and they are used off-label for hair loss, so a prescription is needed. Rogaine is available over the counter and is FDA approved for the treatment of hair loss. So in summary, knowing about hair loss treatment with finasteride and minoxidil requires that we know about DHT. Finasteride and minoxidil work in different ways. Finasteride by interrupting the conversion of testosterone to DHT, and minoxidil by increasing blood flow to the hair follicles, supporting the existing follicles. Both medications can be used together. I hope this information is helpful for you today. If so, please like this video and do subscribe to my channel, Transgender Medicine Made Simple. And by the way, if you have a question that you'd like to submit, please do so in the comments below, and I might get to it at a later section. Thanks for watching, and I'll see you in the next video.